VCY America presents Crosstalk, a nationwide call-in program discussing issues that have an effect on our families, our communities, our churches, our nation, and our world. Crosstalk, an opportunity for you to voice your concerns for biblical principles. And now live by satellite and around the world on the internet at vcyamerica.org. Here is today's Crosstalk.
Well, thank you for joining us today here on Crosstalk. And normally we do a news wrap-up and roundup on Fridays. Today will not be the case. There's some other important issues we'll be talking about. But just before we get to our guest here for today, it is my perspective that it was a very disappointing vote that took place yesterday with the Scouts, and a tragic day for Scouting as they allow for open homosexuality within the Scouts. And I just want you to know that this is not the end of the activist homosexual agenda for the Scouts. It's not like, okay, we won, now we're moving on. But folks, looking at this policy change that has taken place, the Human Rights Campaign that works for lesbian, gay, bisexual, and transgender equal rights, their president, Chad Griffin, said, quote, "The new policy doesn't go far enough. Parents and adults of good moral character, regardless of sexual orientation, should be able to volunteer their time to mentor the next generation of Americans." And then there's Zach Walls, the Eagle Scout and Executive Director of Scouts for Equality, who said the Boy Scouts of America can do better. "We welcome the news that the ban on gay scouts is history, but our work isn't over until we honor the Scout law by making this American institution open and affirming to all." In addition, the atheists are disappointed. The Secular Coalition of America said that the Boy Scouts' recent decision to allow openly gay boys is a positive step in the right direction, does not go far enough, expressing disappointment that they have decided to continue the policy of discrimination against atheist and gay Scout leaders. So, folks, I want you to know that this battle for values is not over in the Boy Scouts, and it's my belief that it's just going to be a matter of time before homosexual leaders, mentors, den leaders, volunteers will also be allowed who are practicing homosexuals. Transitioning to our topic here today, folks, we are seeing some grave concern arise continuously throughout the nation as to the direction of the so-called Affordable Care Act, otherwise dubbed Obamacare. Even President Obama refers to it as Obamacare. And today we have a startling question to ask, and this question is this: does Medicare want your doctor to quit? We're going to be discussing that issue today with our guest, Dr. Alida Eck, who is the past president and current member of the AAPS, the Association of American Physicians and Surgeons. She and her husband founded the Zarephath Health Center. It's a free clinic for the poor and uninsured that currently cares for 300 to 400 patients per month, utilizing the donated services of volunteer physicians and nurses in New Jersey. Dr. Eck, thank you for being with us today.
Oh, thank you for having me.
There are some significant changes that are going on in Medicare right now that have caused you as a medical doctor some very great concern. Tell us what's happening.
Well, just the paperwork burden has been increasing throughout the years. It's not totally new, but under Obamacare and under the new laws that are just being written, it seems monthly, it's just becoming more and more burdensome. And the op-ed I wrote just said, either I can continue to provide comprehensive, personalized care to my patients, or I can focus on the paperwork and the mandates and the forms required to get paid. It's just overwhelming what they're expecting of us. And some of it is so confusing you can't decipher it even off their website, what they're expecting.
So how is the government interfering with what you believe is in the best interest of your patients?
Well, in the regards to just the whole thing with the electronic medical records, they want us to put them online so that they can peruse them and decide if we're doing too much or too little. And all that takes time. It takes time away from FaceTime with our patient to be doing all of that. And then they want us to code every little thing. They're going from what's called the ICD-9 to an ICD-10, which will increase by a factor of 6 the number of different codes we choose from. And it's just unbelievable minutia that is not related to good patient care, but it's related to some kind of statistical measurements that they're going to use somehow in the future. I don't think it's going to be a good thing as to what they're going to use it for. It is becoming so frustrating that doctors are just saying, I'm not doing this, or I'm just going to move out. And They estimate it's going to cost $85,000 per physician to transition from this one code system, ICD-9 to ICD-10. And can you imagine every doctor having to spend $85,000 to accomplish essentially nothing, but in order for Medicare to continue to pay us? So that's the kind of thing that we're just looking at. And then Obamacare is going to just add more and more strain on us, that the whole medical system is going to become in such upheaval that those of us who begin to choose to say, look, I'm just pulling out of all of that. My office is over here. If you come to me, just give me a fair fee, and I'll take care of you, and that'll be that. That's what's going to wind up happening, I believe. And those patients will be fortunate if there's a doctor willing to do that.
You write in your piece, you say this: I must trust the dictates of those who never went to medical school. They cannot possibly know what is the best for the patient sitting in front of me. Will I allow my judgment to be clouded by those with the power to deny me payment if I do not comply with their standards? So you're talking about the increased burden of paperwork, not dictating to you exactly what care you can give to your patients. Is that correct?
Right, and they're going to measure us on things that are measurable, that have a number. For instance, if it's a diabetic, there's a number called the A1C, the hemoglobin A1C. And if that is down at the normal range, which is 5 or 6, that's considered good diabetic control. Well, there are many, many reasons why the A1C can be low or high, and it can be related to what the patient does, what they eat, and whether they take their medicine or not. But to put that all on the responsibility of the physician is not reasonable. They're going to tell us that you can give a certain medicine if a patient comes down with diabetes. If that doesn't work, then go to the next medicine. Well, we might have enough judgment to say the first medicine isn't going to work or is not good for this particular patient. We want to go straight to that second medicine. And they're going to be telling us, no, you can't do that. Same thing with high blood pressure. There's just lots of different choices of high blood pressure medicine. Mm-hmm. And we ought to be able to work with the patient to choose what's the best for the patient in front of us, not some algorithm that has been designed by somebody out there that does not know my patient. That's what we find extremely frustrating.
Let's talk about those electronic medical records you spoke of. I understand that your payments are actually being cut because you don't send your prescriptions to the pharmacies electronically?
That's right. They're taking a certain percentage off of what they pay me, and that's not totally clear. I try to think like a bureaucrat, and I'm not really good at that.
Why would the government care how you send your prescriptions to the pharmacy?
They just want I don't know. They just want the data. They want to know. Maybe they want to know. Perhaps if I give somebody a prescription and they don't get it filled, they want to know that. And if I send an electrician, I'm just thinking out loud right now, if the patient doesn't get it filled, that would be noncompliance. And they're talking about noncompliance as being another ailment that we need to diagnose. A patient doesn't do what we said. Oh, they're a noncompliant patient. That's not an illness. That's just a person exercising his own choice. I give prescriptions out. I assume that most of my patients do get them filled. I'm careful to give them something that's not going to be unaffordable, but perhaps if we send them off electronically, I'm not sure why. But whatever it is, yeah, they've already docked my what they pay me for Medicare patients because I refuse to do that online.
Does the government have access to those prescriptions?
Through the pharmacies, I'm sure they do. Otherwise, they would not really have that kind of sway over us. They also want us to put our whole record online, which, again, I just won't do that because the Oath of Hippocrates says that I am going to keep the discussion I have with my patient private. And if I just take that whole discussion and put it online for anybody to read, they claim there's HIPAA compliance and all this privacy stuff, but it's the exact opposite because, with WikiLeaks, we know that people can get into medical records or any kind of records that where they ought not be, and the best I could say is sorry. So I just won't do it. I will give the records to my patients. They can take it somewhere to the next doctor, but I won't put them online.
Isn't the future rulings under Obamacare, doesn't that require you to have your medical records electronically available, or is that just an option with a penalty if you don't?
Right. So far, it's an option with a penalty if you don't. If we don't get involved with any of the insurance exchanges, and if we just have an office where people pay us a fair fee, and then let them deal with insurance, it's also another way to get around it. There's lots of practices that are starting to do that. They just some of them will charge the patient $50 a month and take care of them when they need it. It's kind of like a retainer idea, but not an exorbitant amount of money.
Mm-hmm.
And that's something that some doctors are thinking of, because what we spend to do all the billing to insurance companies related to what we get back. I don't know if this is a new thing, but I've been just noticing in the checks that come from insurance companies, sometimes they're like $8.53, sometimes they're 79 cents. I mean, I don't even know what they're doing. The patients might be paying some of the difference, but it's just ridiculous what these insurance companies think they're doing.
Mm-hmm.
And it's just no way to run any kind of business.
Tell us about the PQRS, the Physician Quality Reporting System.
It's a new entity that PQRS, and I had no idea what it was, so I looked online. And after I looked online, I still don't know what it is. But it's a way that they're going to decide, again, how to pay us. And we have to submit the data to the Medicare system. And it could be, they say, claims-based, registry-based, qualified electronic health record, or group practice reporting option-based. I still don't know what they're saying. But we can choose different ways to report, and they will apply a measure applicability validation, MAV, process to determine incentive eligibility. Refer to MAV available. Then it says, if you get it wrong, though, if you do the same thing last year that you did this year, then you will find that you might not be eligible, or you might not get paid. So I'm really glad I didn't look at this last year.
Yeah, so rules change, and you perhaps aren't even notified about it.
I really want to be dealing with this. I want to see people.
Yeah.
I want to measure their blood pressure and their height and their weight, and talk to them and see what's bothering them and treat them. I really don't want to deal with this stuff that Medicare is just putting on us. It's just people sitting in offices that are just thinking of more and more ways to regulate and mandate and meddle and restrict and just make providing health care extraordinarily difficult. And it's not unlike what the teachers have gone through. I know this because the teachers complain. They just find it so hard. They have to teach to a certain test, and it's the paperwork and over. And anytime you get the government involved, all they can do is make more and more rules that harass us.
And again, one of those rules you referred to was this new updated ICD-10 code book. I understand it's October 2014 that comes out? Yeah,
that's right. And as far as I know, most physicians' offices aren't nearly prepared for that. That's what they told us. It would cost us $85,000 to revamp any system you now had. It's not only adding new numbers. There's digits and there's letters, and it's a whole different way of doing the billing that will become impossible. They already postponed it a year, and the AMA has said, listen, you really got to postpone this because doctors aren't ready. But the government has just stated, nope, you've already postponed it once, and we're going to just do this. And I have no idea what's going to happen then, except that I'm not doing that.
Dr. Alita Eck is our guest here today on Crosstalk. Does Medicare want your doctor to quit? Doing everything possible to get doctors frustrated in the process. We're going to take a quick 60-second break and be back. You're listening to Crosstalk on VCY America.
Back to Genesis with Dr. John Morris, creation seminar speaker and president of the Institute for Creation Research. Dr. Morris, how similar are birds and dinosaurs?
Chris, has become popular for evolutionists to claim these days that birds are actually dinosaurs, that the dinosaurs aren't extinct, they continue on in birds. How foolish! We suspect that dinosaurs were a special category of reptiles, but reptiles and birds are very, very different. They have a different heart style and different respiratory systems. Their soft anatomy is very different. Their organs are hardly comparable, different in every way. It is true that the skeletons of birds and dinosaurs have many similarities. Humans are similar too, but they're different. And it's been that way ever since, back in Genesis.
If you'd like to go back to Genesis, you can find us on the web at www.icr.org. For the Institute for Creation Research, I'm Chris O'Brien. Thanks for tuning in.
This is Crosstalk on VCY America. We're speaking today with Dr. Alida Eck. She is the past president and a current member of the AAPS. That's the Association of American Physicians and Surgeons. And we're talking about all the new regulations, all the heavy-handedness, all the red tape that is coming down upon medical doctors for taking Medicare patients. And we understand, Dr. Eck, that there's just a number of physicians who are saying, I've had it, enough is enough, I'm opting out of Medicare. How serious is this problem?
It's very serious. More and more doctors are just doing that. And they're opting out. What's happening is the physicians can still see the Medicare patient. The Medicare patient has to understand that their fee will not be covered by Medicare, nor can they recoup that from Medicare. However, if those physicians see a Medicare patient and order any kind of test, or if they go into the hospital, those things would still be covered. So it's just the physician fee that is being eliminated from the equation, and the physician is just saying, I can't do this anymore. I want to take care of you, and I don't want to be an agent of the government.
Mm-hmm. Now, with all these created exchanges taking place, or I'm sorry, I guess they changed the word to marketplace now, with all these created marketplaces that are taking place in individual states, and some states are doing partnership with the federal government, and other states have said, no way, we're not going to be involved with that federal government. This is your problem. You do it. Could those same mandates come down for any type of patient that you see that would have participation in any one of these exchanges or marketplaces?
Well, the patient would have to know. Presumably, if they're going to an exchange and they're getting a subsidy from the federal government, they're getting a better deal. So they have to take that into consideration. But again, they might find that they're in an exchange, they're paying for this insurance, and there's nobody that's willing to see them in that. So they're going to say, well, this isn't worth it. I'd rather not have this insurance. And, of course, with Obama, you're mandated to have insurance, or the IRS is going to come after you. This is still America, though, and I just think that something is going to happen, that people are going to say enough is enough. And perhaps this whole IRS scandal will be the impetus, to give us the impetus to just say, we can't have these people running our healthcare system.
Well, let me ask you about the IRS. I mean, the official at the IRS that was in charge during the targeting of the Tea Party and the Patriot groups is now the one to be running the IRS office that's responsible for health care legislation. I'm guessing that's not going to give you confidence.
That's pretty astounding, isn't it? It almost makes you laugh if it weren't so tragic, but that's right. These people are going to try to run our health care system. The same ones, even the ones who plead the Fifth Amendment, don't want to answer questions.
Dr. Eck, there's a number of physicians that are actually leaving private practice and they're joining large hospitals, they're joining large groups. Why is this not good?
Well, now again, who are they working for? I think a physician who works for a hospital can be extremely well-intentioned, but what if the hospital says that if a patient reaches a certain state, we're just going to put them on hospice, and meaning that that's kind of a way to let them die. And now the physician's going to say, well, this person really isn't dying. I don't want to do that. But the hospital could say, you have to do it anyway. Your job depends on it. So I find that to be an untenable situation where now I have to answer to this employer who I might not agree with. I'd rather use my own judgment to take care of the patient that's sitting in front of me. So that's a worry. The other thing is that the physicians who do this, it seems like a good deal for them because now the hospital is going to give them a salary. They don't have to worry about paying the staff. They can go on vacation a certain amount of times a year. They become like employees. But what if the money dries up? What if the federal government doesn't come through and pay the hospital? The doctor could just be out and not even be in practice at all. So I don't think it's a very smart thing for a physician to do, but it's extremely common. 1 in 3 used to be employed physicians, and it's going to be 2 in 3. So it's going to be 2/3 of physicians in the next couple of years are going to be employed by hospitals or big groups.
What was that ratio?
2/3.
2/3.
Right now it's 1/3.
Wow.
It's going to be 2/3 very, very soon.
What impact will that have on patients?
Well, again, you can't serve two masters. I think that the physicians need to understand that the oath of Hippocrates says that their focus has to be on the patient. The patient might find that the physician is double-minded and just can't quite. It doesn't quite have their best interests at heart. I'm not going to name any kind of specific examples, but just think of the ramifications of what could happen if you let others dictate exactly what a physician does and doesn't do. It just seems like a dangerous way. More and more physicians aren't going to the hospital, the primary care doctors. I find that to be not a good thing, because we are the ones that know the patients, and we can direct the specialists as to what is a good idea for this patient and what is not. It can become dangerous if the patient isn't in the care of his own primary doctor, and he doesn't come to see them in the hospital, and the patient isn't doing well in the ICU. They can just assume, well, this is a hopeless case. We'll just let this person go. And it might be something that's just very temporary. That kind of thing. I think that the hospitals want to be completely seamless. They want to get all the payments, and then they want to be able to pay the doctors. But, of course, then the hospital executives are getting paid first, and it's kind of it's just not good I don't think it's good for patients.
Now, as a physician, are you concerned about this IPAB, the Independent Payment Advisory Board?
Oh, absolutely. That doesn't make any sense. Have these, I guess it's 16 people that are just appointed who make decisions whether who lives and who dies. Over a certain age, you get dialysis. Under a certain age, you don't, or the other way around. But the point is that who can make that kind of decision? Because we all know 75-year-olds that appear like they're 55, and some 75-year-olds seem very, very old. You can't go by age. Mm-hmm. You can't. They just can't be making decisions like that.
What about you personally? Are you planning to hold on? Are you going to continue to treat Medicare patients?
So far, I'm continuing to treat Medicare patients. I don't do any other insurance. So all the other patients pay us, and they get reimbursed by their insurance company. We also have a lot of patients that are on Medishare and Samaritan Ministries. Mm-hmm. These are the faith-based ministries that everybody who is a Christian ought to be really looking at, because they're a great alternative to Obamacare. Much less expensive, and it gives a lot more independence to the physicians.
And actually, it will cause them to be exempt from Obamacare then, too.
That's right. Mm-hmm. That's right. They'll count. It'll cost a lot less, and they will be exempt from having to buy Obamacare insurance. So that's a silver lining. That's a good thing. So I have those kind of patients. I'm still seeing Medicare patients. I think if I drop Medicare, probably half of the people I see are loyal enough that they'll continue to see me and be willing to pay me a fair price, and then just forego the Medicare help for my services.
And yet there are others who can't do that. I mean, where will this leave patients that are as young as 65 years old?
That's right. Where will it lead? Well, we've got another option, because we have this free clinic that we have. Mm-hmm. So people who are really stuck and poor and have no money, we see happily in this non-government free clinic, which is run by all Christian volunteers. It's a wonderful alternative to the government system for the poor. But, people have to make decisions. I know they buy cell phones, and they have all kinds of things that they can afford. I don't think that our fees are that bad in primary care, especially if we're not encumbered with having to do all that insurance and have to hire all those secretaries. Mm-hmm. That, if you can afford to get your car oil changed at Jiffy Lube, you can probably come to me.
Our nation right now is facing some uncharted waters. It's certainly alarming to hear the likes of Senator Harry Reid, Senator Max Baucus speak of their fears of a coming train wreck. What do you see coming ahead for medicine and the American people? I mean, do you fear a train wreck in this regard?
Well, if Obamacare goes as scheduled, yes, it will be a train wreck. And it's very, very interesting to hear the Democrats who voted for it and were so proud of it say that. They're recognizing that it's just untenable, and the bureaucracy is going to be way too huge, and the people just will not be they just will be cogs in the wheel to make their little machine of healthcare move right. People are independent; they do what they want to do. So I think that Obamacare will collapse under its own weight, but hopefully we won't be underneath when it does.
I see that the AAPS, Association of American Physicians and Surgeons, that the group has filed a lawsuit in federal court against the American Board of Medical Specialties. Who is this group, and why was this action filed?
We are a group formed in 1943 to stop anything that would affect the physician-patient relationship, anything that would encumber us, and to fight against those entities. And the American Board of Medical Specialties has just gotten bigger and bigger and more burdensome on the doctors. There's 24 medical specialty boards under them, and they are requiring us to recertify, do maintenance of certification, spend a lot of money away from our patients, away from our practices, and they're a monopoly. They are a private organization that shouldn't have that much power. We believe in physicians keeping up and being current, but it shouldn't be only one way, and it shouldn't be this expensive way that is burdening us. So the only way we could stop it, they were just getting more and more regulations and more funding and more frequent. We'd have to retake these tests and do what's called maintenance of certification. And so we're just saying enough is enough. 92% of physicians agree with us. Our new members are skyrocketing, and we're bringing in money to help fund this lawsuit. But I don't think it'll cost us a lot of money because it's just right. That's just another thing that's happening to doctors that ought to be curtailed.
There is so much going on here, Dr. Eck. We've talked about so many things: as updated ICD-10 code book, the physician quality reporting system, talking about this new electronic medical records and penalties to doctors who don't send the prescriptions to the pharmacist by way of electronic means. So we talk about some of these new things coming forth as far as the training and so on, and then the spiraling train going down the tracks. What can our listeners do? Is there anything?
Well, find a doctor that you know and you care about, and just implore them to stay in practice, so they'll be there for you when you need it. Especially the primary care doctors; they're kind of under the greatest assault. And so that's what you could do as a Christian community. You can help start a clinic in your church, get doctors to help, and figure out a way to bypass the Medicaid system, which is costing the taxpayers so much and is really providing very inadequate care for the poor. Our clinic has started 10 years ago, and our church went from 150 to 2,000 since we did that.
My.
That's what people are hungry for. They want something to sink their teeth in to help, and then the people come and they find the Lord through that. So, with God, all things are possible. We can just have to recognize what the problems are, though, first, and then deal with them.
Dr. Alida Eck is our guest here today on Crosstalk. We're opening our phone lines. Our number 800-733-9829, 800-733-9829. The topic today: does Medicare want your doctor to quit? Well, we'll take your calls after the break. You're listening to Crosstalk.
Most people devote much time researching and investigating important issues before making a decision or reaching a conclusion. Yet when faced with the most important issue of their earthly life, where will I spend eternity, they appear to be unconcerned or disinterested. Since God does not promise anyone tomorrow, and man's eternal destiny is sealed at death, would it not be wise to investigate these things? That's the purpose of the book, Preparing for Eternity, in which author Mike Gendron contrasts the truth of God's Word with the teachings and traditions he was taught for over 30 years in the Roman Catholic Church. He found that eternal life is not merited by good works, but is given freely by God's grace to those who put their faith and trust in the Lord Jesus Christ as their all-sufficient Savior. The book, Preparing for Eternity, is available for a donation of $17 or more to VCY America by calling 1-800-729-9829. That's 1-800-729-9829.
You're listening to Crosstalk on VCY America. Dr. Alida Eck is our guest today, a past president and current member of AAPS, the Association of American Physicians and Surgeons. And this group maintains quite an active website. Dr. Eck, tell us about it.
It's a good website. You can there's videos of some of the directors speaking and other members. It's aapsonline.org. But we just believe in the private physician-patient relationship, and that we need to maintain that for the best medical care.
Again, that's aapsonline.org. Great. Mm-hmm. Okay, folks, and certainly check out the website. And today we're going to take your phone calls, 800-733-9829. We're going to begin in Santa Rosa Beach, Florida. Kelsey, you're on the air.
Hi, Dr. Alida. Thank you so much for taking my call. Having lost a job and the benefits and all of that goes along with it, and an older woman in my 60s, I've developed a couple of health problems. So I'm kind of scouting around, and I found a Christian clinic in my area who has done the initial intake. But, of course, it's, precedent, who's going to get the medical care. My question to you this afternoon, Dr. Alida, with the Obamacare having to sort of pay into this health care system, would we be seeing choice of who is most at need for medical care? And I believe that's the question I have for you. Thank you so much.
Thank you.
Well, generally, they just want to set up a huge system, and they want everybody paying into this huge system, and they're assuming that after they pay all of those who are shuffling the papers, that there'll be enough to filter down and pay the physicians to provide plenty of care for everybody that wants it. And it's just not a reasonable possibility. It's just not going to happen. We can go by the Medicaid system, which is a terrible, terrible system. It pays the doctors so little that most of the doctors, and again, the paperwork is so huge that they can't get into it. And we're watching people fall through the cracks. We're picking them up at our Zarephath Health Center, our free clinic. So if the Christian community is around and is united, people's health care needs ought to be able to be met, even with helping with the non-medical care that people need, just to be a community. That's the best way to do. I don't think Obamacare is going to make it any easier for you.
Thank you.
Thank you, Kelsey. We're going next to Harry in Port Huron, Michigan. You're on the air, Harry.
Hey, Jim. Thank you very much for this. Lita, I love what you folks are up to with the clinic idea, because with Medicaid, when you have assets over $2,000, you can't do anything with your life. You have no health care. And so I applaud what you're doing. However, I do have the thought that I like the idea of the electronic medical records, because I don't know about anybody else, but every time you go to a new doctor, you gotta fill out paperwork with the same questions you asked when you went to the first doctor. So I think there's a value to that.
Well, just one thing, Harry, and part of her penalty is not submitting a prescription by electronic means to the pharmacist.
I've had to do that now. We have to, my doctor calls or faxes it to my pharmacist, which I have to tell you, in a way I like it better that way, because I don't have to run to two places that day.
And would you like it, Harry, then, when the IRS officials have access to those two?
I don't see what the big idea is about it.
Yeah.
As far as your medical record, if I were you, I would just kind of type up my history, and as it goes along, you can add to it on the computer, and you can do a lot of that yourself. I will give anybody my medical record. I have one in my office. It's just I'm not going to put it online. So you can have that history and get it from me and then bring it to the next doctor. It might be a little bit more cumbersome, but I tell you, you can make, if you make it all totally computerized and your privacy is gone, you might not like the outcome.
Unintended consequences.
That's right.
Thank you, Harry. To Cleveland, Ohio, Julianne, you're on the air.
Hi, Dr. X. My name is Julianne, and I am actually going to be attending my first year of medical school in the fall. and I was just listening to the show, and I was just curious to know if you have any advice for anyone that's up and coming in the medical field, because I've gotten so many controversial opinions from different physicians on whether or not the new Affordable Care Act is a good thing or a positive thing with reimbursements to physicians and everything. So I was just wondering if you had any advice.
Sure. Number one, congratulations. You're in a great profession, and I absolutely love being a doctor. One of my sons is a doctor, and it's a wonderful profession. We just need to fix it for you. Join the Benjamin Rush Society. If there's not one in your area, in your medical school, start one. The Benjamin Rush Society is for medical students, and then the Association of American Physicians and Surgeons will help to guide you with some of these issues, because you got to watch out for all of these issues that are coming down the pike, and you need to fight for what's best for your patients and the profession. Mm-hmm. But enjoy what you're learning, and I think you'll find that it's a very, very wonderful profession that hopefully we will be able to salvage.
Thank you so much.
Okay. Yeah, congratulations.
Have a good day.
Thank you
so much.
Thanks for your call here today. Our number, 800-733-9829. Have a couple open lines again, 800-733-9829. Wanda in Chattanooga, you're next.
Thank you for taking my call. I am concerned about all this, too, and my husband and I are both on Medicare right now, but we don't know anything about Medishare, and I'd just like to know more about it and how to do it and how it would benefit us.
You go to the website medi-share.org, and you can find a lot about that. And they are actually beginning to enroll people in the Medicare age, so this could be a good thing for you.
And also, as you mentioned, SamaritanMinistries.org is
That's
another.
the other one, yep.
Mm-hmm.
And then, there's a third one. I think there's HealthSharingMinistries.org. You can learn about all three. There's just three of them.
How do, in essence, Dr. Eck, how do these types of organizations work?
Medishare, I know the best because I'm on their board, but what they do is you have a bank account, and every month you put a fixed amount in there, and you give them power of attorney to take the money out of your account and put it into the account of the patient who needs it that month. So it's a very, very ingenious way of us to bear one another's burdens.
And when it's your turn that you need medical care?
That's right. It'll go the other way.
Okay.
And you send the bills in, and they process them and get a lot of the big bills reduced. Now, and then we share one another's burdens without you're not paying for a huge like some of the executive compensations of the big insurance companies are just huge in the multi-millions, and I can tell you that's not what happens in these ministries. So it's very, very efficient. Mm-hmm. Plus, you can't smoke and be in these organizations, and when you think about it, there's certain lifestyle issues which raise the cost of health care for everyone. And because of that, we've lowered the amount that you need to pay every month by about 70%. That's how much we save when you live a healthy lifestyle.
Thank you, Wanda.
Thank you.
Mm-hmm. Bye-bye now. And let me ask you this, too, on some of these alternative programs, and these are not insurance programs, correct?
That's right. They're not officially insurance.
But it's my understanding that a person who does not want to be under Obamacare and they want one of these alternatives, that is it required that they join before January 1st or not?
Oh, that's a good question. I'm not sure when they have to join. Okay. The particular organization has to have been in existence before the year 2000, mm-hmm. so they can't start new ones.
Okay. But after Obamacare is fully implemented, can a person leave Obamacare to go into one of these? Okay.
I'm sure they'll be able to do that.
Okay. Let's go to Clay City, Illinois. And Toby, you're on the air.
Yeah, my wife's a chiropractor in Illinois, and the way I understand it, she can't opt out of Medicare, so what makes you think that the doctors will have that option before long?
Why can't she? You should opt out.
I understand that she's not allowed as a chiropractor. They're not allowed to opt out of Medicare like the medical doctors.
I have no idea. I can't imagine. That's almost indentured slavery. How can they force you to be into something?
Is she in private practice?
Yes.
You can choose to just see people for cash. You just can't be enrolled at all. Either you're totally in or you're totally out. you can't pick and choose and do Medicare for some people and not the others. You have to totally be out, and then you have to opt out every 2 years. But I hadn't heard that chiropractors can't do that.
I'll have to check into that then. All right.
Yeah.
Thank you.
And could he even check like with AAPS online on that issue?
Yeah, he could look at that. Yeah, and there's probably a place where you can ask a question.
Thank you, Toby. Appreciate that. Let's go next to the state of Oregon. And we have, is it Darla?
Yeah, Daryl.
Daryl, I'm sorry.
Yeah, I have a question. If a person opts out of Medicare, how does that affect if they have supplemental insurance? Because the supplemental insurance is only going to pick up after Medicare leaves off.
Yeah, sometimes the supplemental will pay if it's proven that their doctor has opted out. There have been some supplementals will pay the entire bill, and I find that very interesting. But yeah, that's still in place, and there's ways for you to still put claims into those companies.
All right, thank you.
Thanks for your call. Our number 800-733-9829. To Pensacola, Michael, you're on the air.
Yes, I'd like to ask a question. In the past 20 years, has Medicaid care been getting better or worse?
I don't know how to compare it. I just know it's terrible. It pays about, in our state, I'm from New Jersey, and it pays about 17 cents on the dollar for what our expenses are. So if I take Medicaid, I lose money with every patient. Therefore, it's actually less expensive for me to take care of them for free, which is why we have our free clinic.
Well, that's interesting.
Okay, next question. Is in the future, all the stuff is going to be electronic anyway. So what's the problem I don't like electronic stuff anyway, but prescriptions will be called in by the physicians through electronically anyway.
Well, I fax them in. I'll do that. I don't know what else I can do. I'll fax them in. I like electronics. I like modern technology. I just worry about the privacy part. And I worry about again, I don't understand what the reasoning is, why the government would be so insistent on me sending in the prescriptions electronically. What difference does it make? Why do they care? So it makes me suspicious.
Thank you, Michael. Appreciate your calls here today. And let's go next to Kathy in Monroe, Wisconsin. You're on the air.
Hi. Yeah, I was watching a program on satellite about this Obamacare and how people are already, complaining because they go to their doctor, and then the doctor tells them, well, they can no longer treat them, so that not to come back. So I don't know if you've heard that, where physicians and because they're not getting reimbursed from Medicare or Medicaid.
Well, it might be that they've opted out of some of these programs, or they're not in the insurance exchanges. I would be real unhappy with my staff if I told people not to come back. Usually there's some way that I could see them. So I have no idea what is going on specifically with that.
Is there any way to control these costs, with, like the insurance companies, they will only allow a certain amount, and then, of course, in the balance is given to the patient.
So, thank you, Kathy. We'll cover that question on the other side of the break. You're listening to Crosstalk on VCY America. Our number 800-733-9829.
For the Worldview Weekend Minute, I'm Brandon House. Our website's worldviewweekend.com. We're continuing our series on a biblical worldview and money, 20 points. Today we're on point number 13. A man is responsible to provide for his family, both spiritually and materially. 1 Timothy 5, verse 8 speaks of this. A man who doesn't provide for his family is worse than an infidel, an unbeliever, a heathen. We provide for our family spiritually and materially. We get up, we work, we save, we can serve. We don't lay around. In fact, did you know that in the Scriptures, in the New Testament, a man that will not get up and work is subject to church discipline? Did you know that? The Scriptures speak to actually performing church discipline on a man that is physically able but will not go and get a job and provide for his family. So a man is responsible biblically to provide for his family, both spiritually and materially. We need to have a biblical worldview when it comes to money. If you want more information on this, our website's worldviewweekend.com.
You're listening to Crosstalk here on VCY America. Speaking with us is Dr. Alida Eck, past president and current member of the AAPS, the Association of American Physicians and Surgeons. She, along with her husband, have founded the Zarephath Health Center. It's a free clinic for the poor and uninsured, and they're seeing 300 to 400 patients a month and using donated services of volunteer physicians and nurses in the state of New Jersey. Dr. Eck, the caller here before the break, was talking about how can we control these costs and the insurance and the insurance reimbursements and all those types of things. How do you respond to that?
Well, you've seen the different programs that have been coming out, and the Brill article in Time Magazine, a huge article that talks about how some hospitals will charge 10 times more than a hospital in another town. Those are called the Chargemaster Prices, and because the government is insisting on getting a great discount, they've figured out, well, if I charge 10 times more and they'll only pay me 10%, I'll get what I need. So that it's totally non-transparent, all that pricing. Very, very confusing. If you can find a place where you could actually negotiate prices, and you can, talk to the doctor and say, what would it cost me to have this done if I can just pay you? You'll find out the prices can be very, very reasonable. And that's what's got to happen. More and more people have to care what things cost. Commonly, when we have insurance, we just add insurance, we're going to pay it, I don't care. But that can become a problem, especially if there's a huge deductible that you have to pay first.
Mm-hmm. Let's go back to the phone lines. We have Gary calling from the state of Ohio. Hi, Gary, you're on the air.
This is the doctor. Do you remember when Obama says that your health care insurance would not go up when your work health, your insurance at work?
Mm-hmm.
See, I worked at Walmart for 7 years, and when I first started, we got Blue Cross Blue Shield, which was probably one of the best you probably could get. Mine was no more than $25. Now, since then, he passed this law, it's gone up to $40 or $50. And that's some things that people don't know about. And $1 is going to be $80 or $90. We can no longer afford it. We can't even afford it, Howard, to pay for that kind of money. I'd like to have the doctor comment on that, and I'll hang up and listen.
Yeah, Obamacare is really not going to lower the costs because all that they're promising to be covered under Obamacare, plus the fact that everybody's going to be in the same pool with all the pre-existing conditions and all of the things that violate the whole insurance principle are not going to be in place, and it's just not going to be less expensive. You're going to offer so many more benefits. You're going to have so many more people on there that are going to be clamoring for benefits and for the medical care, and it will not. The insurance premiums will not go down. That doesn't mean doctors are going to be paid more. It just means that the insurance premiums are not going to be less.
Dr. X, some of the leading labor unions are waking up this week with real concerns about Obamacare and the new unexpected consequences in the law. In one polite way, there was a labor leader that said, quote, "It makes an untruth of what the president said, that if you like your insurance, you can keep it. This is not going to be true for millions of workers now."
Not to mention many of them are going to lose the jobs are be brought down to 29 hours a week, so that they will not be considered full-time. That's already happening. That's a huge unintended consequence because the employers have to give every full-time employee the full benefits, and if they're not full-time, if they're less than 30 hours a week, then the employer doesn't have to pay a fine. So that's what's happening. Employers are there to stay in business, not to be providing health care for everybody. And I don't know, mixing employment with the health care is something that might have made sense 50 years ago, but it really doesn't make that much sense anymore.
Let's go next to Michael in Madison. Michael, you're on the air.
Hey, thank you. I'm in my third year of undergrad study, and I'm looking to go into the pharmaceutical industry. How is this Obamacare going to be affecting my industry of being a pharmacist?
Yeah, I was a pharmacist before I went to medical school. Good education. I don't know exactly what's going to happen there, except that there's going to be formularies that are going to be devised as to what we can prescribe. I would hope that there's still going to be the research and development that we've had, which makes America has been the powerhouse of coming up with a wonderful new treatments, and hopefully that will not be curtailed. I fear it will, because of the way the pharmaceutical companies have been treated with, I would say, almost disdain by the government, and that bothers me.
Will one way pharmacists be affected by this is the lack of prescriptions that are going to be allowed or permitted under Obamacare?
Yeah, that's part of it. Yeah, I really can't predict exactly what's going to happen with the pharmaceutical. It's been under a lot of pressure for a long time, but hopefully, your profession will be okay. Certainly, having good training is good, but I really can't predict exactly what's going to happen.
Thanks, Michael, for the call. And one more call in Stanley, Wisconsin. Randy, you're on the air.
Hi, my question was, for people who can't afford insurance, private insurance, or they're poor, and the only thing they have is Medicare, or in Wisconsin, we got a Badger Care program. And if you don't have it, how can you get health care or treatment?
Well, we're trying to set up here in New Jersey, where this law is coming down the pike. That would be doctors donate 4 hours a week in a non-government free clinic, which would cost you nothing. And then the physician then would donate the time, and then the state would protect us from malpractice in our private practices instead of trying to pay us. So the patients, the physicians, and the taxpayers would be huge winners in this. And then people would get the health care they need, even if they can't afford it. So
it just seems that there aren't very many of those free clinics around.
There will be. If this type of law gets passed, then the doctor's going to be looking for places to volunteer.
Is there somebody pushing that law right now?
Yeah, it's been introduced in the state of New Jersey, and we're just waiting for them to bring it up for a Senate committee, the Health Committee vote, and then go to the whole Senate. So watch online. You can watch the AAPSonline.org website for that progress.
And that's one state, but it needs to be duplicated in every other state.
10 other states are watching us closely that want to do it.
Great. Thank you for the call, Randy. We're out of time. Dr. Alita Eck has been our guest here today. The website, aapsonline.org. Dr. Eck, thank you for joining us today.
Thank you.
And
it's
folks,
a pleasure.
Thanks for joining us today on Crosstalk.
Listening to Crosstalk via satellite and the internet from VCY America. Views expressed may or may not be those of this station. For a CD of today's program, send a donation of $6 or more to VCY Take Ministry, 3434 West Kilbourne Avenue, Milwaukee, Wisconsin, 53208, or download by RSS or podcast from crosstalkamerica.com. And join us again for Crosstalk.